Okay, so as we continue on looking at, now that we've covered the characteristics of life and the requirements for life, we want to focus on this very important concept called homeostasis. All right, and this is the idea that the way your body works, like a machine, right? We want to keep it operating in these ranges, right? Temperatures, pH, glucose levels, and calcium, and so forth. And these levels of things in your body and these conditions in your body change. They change with the environment you go into. They change with the things that you put into your body. They change through time because your body uses them, right? So just like you're always using energy, and so you have to have a constant input of energy, well, as you do that, other things enter and they may upset the balance, and the balance again is known as homeostasis. So I say, you basically operate around some set point, or some rules, if you will. And this is a normal range with some variation. In other words, it can go up and down, but it needs to stay within that. All right. Probably the easiest way to describe this is if you've ever gotten blood work done at a doctor's office and you've seen the report. They generally come out in 3 columns, right? And the middle column is the homeostatic range. And then they flag whether you're low or high, the other 2 columns. So now you have a kind of an indicator. And so there's lots and lots of things, when they do blood work that they're looking for in order to try to figure out what's wrong with you. Because if you report with something wrong, you've deviated from homeostasis. You've been unable to return to this balance, and we have to figure out where it is so we can try to help you, right? So I mentioned here that you are really a bunch of solutions. There's about 42 liters in total, and it's divvied up in compartments. So this little cartoon kind of shows you've got intracellular, so inside the cell fluids. All right, you have this interstitial, so the in-between fluids. You have plasma in your blood. You have lymph. You have cerebrospinal fluid. So there's a lot of collective, right? So if it's outside the cell, we call it extracellular. Inside, it's intracellular. But again, all said and done, it's about 42 liters, all right? So these are exchanged. So it's easy for something that you put into your body that gets into the blood to then affect the cells and affect the balance in the cells and the balance in the other fluid compartments. Right? Whoops. Come on. There we go. All right. So if I deviate from homeostasis and I'm normal, then I have to be able to return to homeostasis, okay, to this constant or this range, okay, this average. So we talk about 3 components in order to figure out that you are imbalanced, and then to direct a way to become balanced, okay? So I said 3 components need to detect and correct, right? So to be in homeostasis, right, we have to, when there's a change that occurs, a deviation, we have to be able to reverse that change. So in other words, if your blood pressure decreases, we have to be able to increase it. Okay, and they give you the cartoon generic here of a negative feedback because this is the process of returning. Negative, it's called negative because basically if you've decreased a measure, let's say you've decreased the pH of your blood, you need to go in the opposite, negative, right? Opposite way. You need to increase it, all right? And if you've increased it, you need to decrease it. So the negative is talking about that relationship, all right? And feedback is just refers to, again, you come back to where the problem was, right? Your correction should be where the problem was. That's the feedback, right? So I say here just for clarity, because this will pop up every single time we talk about a system. So there's got to be sensors, and this is part of usually actually the peripheral nervous system, and we get to that at the end of this class. There has to be a sensor and a controller, and that controller is generally the central nervous system, brain and spinal cord, right? So, but together the sensor and the controller, 2 components, right, shown here, are part of the nervous system. That's its job, right? The effector or responder to the deviation, who's going to correct it, will be your muscles or glands. And that's always going to be true. I can guarantee you that. And so here we put it into an actual scenario, right? Your body temperature goes up. Oh, who can imagine that, right, in Texas, right? So it exceeds this 37 Celsius, 98.6 Fahrenheit approximately. So what happens? Well, the nerve cells in the skin and brain, yes, you have thermoreceptors in your skin, you have sensors in the brain, And these, right, detect and start an action potential. The action potential, right, is sent to the hypothalamus. This is the temperature regulatory center in the brain, and we'll explore the hypothalamus more later, right? And the hypothalamus then controls and directs, sends a message, another an action potential again, to, right, sweat glands. And it also sends it to smooth muscle in the blood vessels and says, all right, so you're going to need to dilate to get rid of this heat, and sweat, you're going to need to pick up this heat in the fluids and release it to the environment. And if that works, right, then I will reset my temperature. It had gone up, and if this works, it will come down. All right, so that's really important that you get that, right? So again, normally if you change something, to return it, you have to go in the opposite. That was a negative, right? If it goes up, increases, you need to decrease it. So it is a rule for homeostasis, but every once in a while we want to, right, increase the change that occurred. And that's rare, right? Because you can imagine, right, if I decreased my blood gases, my oxygen level, and I kept decreasing it, well, pretty soon I'm dead, right? So we wouldn't, and again, that if we're changing in the same direction, right, an increase leading to more increases or a decrease leading to more decreases, we call that positive feedback, right? So it would not work for homeostasis, but there are physiological conditions when we need it. And there's two that we talk about in the course, and both of them will be covered in AP2. And that is what we call myometrial contractions, parturition, or labor, as shown here, right? In which the contractions become closer and closer and more intense when they really started out as nice and, not so uncomfortable, right? And blood clotting. So, and both of these do come to an end at some point. They don't just keep increasing, but they initially, an increase leads to more. All right? I say, this is the reality. Again, when you ask yourself, well, when am I imbalanced? I'm like, well, really, I tell students, look, you're damned if you do and you're damned if you don't. You're going to be imbalanced, right? So the art is returning, right? So I say, you require outside stuff, right? We said you've got to have this energy, and with it, you've got to have for driving metabolism, driving synthesis, and in the synthesis processes, you've got to have building blocks. So you need all this stuff, and the vitamins and minerals help to work these chemical reactions, all right? So when you eat, you change the composition. So here we're seeing a very simple cartoon where here nutrients, salts, water come in, and they, as we talked about, they're passed from the digestive tract, they're absorbed into the blood, right? And you'll talk more about that in AP2 as well. And it's moved through the body by the pump, the heart. There's exchange then between the blood and the lungs. And there's exchange between the blood and the urinary system. And there's really exchange between the blood and all the cells. So we have an influence that's constantly. So there's a constant ability to change things. And again, you got to restore them. All right? So we're not going to do the Kahoot here. We're going to do this in class. So I'm just going to move on through this, and we'll talk some more. So in this section, right, we really want to do what we did in lab quite a bit. All right, we didn't spend so much time on homeostasis in lab and characteristics of life. So you've gotten that material. So the last part of Chapter 1 is really complementing what you guys did in lab, right? The relative positions of the body, right? That superior, inferior, the body sections, sagittal, transverse, coronal, and those body regions that we said we have about 41 of, all right? And again, we all have to look at the body in the same way so we have effective communication with each other and understanding, perspective, right? So here's these body regions, right? And this is, they might be slightly different when you look at your lab manual as far as, they might call it cerebral. They have a noun here as opposed to, so they put the adjective in parentheses. So don't be thrown by that, okay? So these of course, again, they're nouns. Their adjectives for this are in parentheses. And they've just done the same thing as they did in your lab manual. They divvied everything up. And we will really assess this more in lab than we do lecture, all right? So anatomical terms, right? Again, we want to figure out where the problem is. We want to be able to communicate that effectively verbally, right, or written to in charting to other people, all right? So we have to agree on our reference point, which we call anatomical position, all right, shown here. And then we're describing everything about the body relative to each other, all right? So superior, inferior, You know, these parentheses just other terms that are used, and I talked about this in lab for the ventral and dorsal, for anterior, posterior, medial, lateral, proximal, distal, superficial, and deep, right? And then I put in italics contralateral and ipsilateral, because when I italicize something or I put it in parentheses, I'm generally not going to use that in a test, or I'm not going to refer to that. I'm providing it so you're aware of it, right? If the body is lying down, you're supine, or you're prone, right? And we'll use those. Those will come into effect when we talk about supination and pronation. So supination on your back and pronation face down, right? So, and that we didn't mention in lab, so that's just additional. Here are the body planes, all right? So when we section something, it's basically a two-dimensional view of a three-dimensional object. So we talk about this idea of the sagittal, which creates a right and left, with mid-sagittal right down the middle, like the head models, and parasagittal if it's kind of parallel to that. And then we have transverse and horizontal, which creates an inferior and superior. And we have the frontal and coronal, which really gives us the anterior posterior. So all you're doing again is when you're doing imaging and slides, you are taking a three-dimensional thing and you're really creating a two-dimensional view, so you can really focus in on something. And we need to understand that. We need to be able to switch back and forth. So these are the compartments, nicely shown, right? They need to be organized. We said that was a characteristic of life. And here's some of that organization. So we don't see anything in these compartments. And this is a nice view to figure out, yeah, these cavities are spaces. Only in the axials, I told you, the appendicular, the arms and legs, or really better said, the upper limbs and lower limbs, right? They are not going to have any vital organs. We didn't have to worry about, creating these spaces and trying to fit everything into it and have it associated well. So in the thoracic cavity, I just remember, you got to quiz yourself often, right? You've got the lungs, and so the cavity is all this space. And here's that mediastinum. I ask you that on your group work. Here's your lungs, here's your heart. All right, abdominal pelvic, so we use a diaphragm as a boundary, like we saw in the pig last night. And that's what I say, what separates these two. And so then we have a whole lot. The abdominal pelvic cavity is not separated by anything physically, like the diaphragm that separates the thoracic from the abdominal pelvic. But we tend to say anything enclosed in the pelvic bones or the pelvic girdle is then in the pelvic cavity, though there's not really a separate there. All right? So here's an example of the 9 and the 4 regions. I told you do not have to worry about the 9 regions. We don't use those in our introductory course, but you may clinically. So if you want to know more about them, please come see me, but I'm not going to be assessing you on them. Here, again, here's our diaphragm up here, here's our pubic area here, so the quadrants are very straightforward, right? And we will ask you to give us examples of things in the quadrants on your quizzes and your practicals. So I said liver, gallbladder, right? We have stomach, spleen, really most of the pancreas in the left, and lots of the intestines right, in the right, and left lower, as well as the appendix, especially in the right lower. All right. This is a lovely cartoon to look at this idea of the serous membranes. But I think I will save this for the last video, so we're going to stop this here, and we'll come back to this in the next video.